Now on your Wednesday. Well, while the fall and the winter months can be filled with a lot of special moments, a lot of fun, seasonal activities, they can also be a time of, in some cases, severe sadness and depression. Psychologists warn symptoms typically begin around this time of year when the light outside starts to change, sun starts to go down at different times. We have joining us this morning Dr. Roy Salgado, a professor of counseling at University of Holy Cross, to help us understand how these seasonal changes can affect our mood. Dr. Salgado, first of all, thanks for joining us.
Thank you.
So let's get into it. I mean, I was just saying, depending on your schedule, I kind of like it when the sun goes down a little earlier, but I will say, that you lose that amount of sunlight, that can have an effect on people, and that's why you call it the seasonal depression or whatever you call it.
Exactly. It's important to recognize that we human beings, along with every other creature on Earth, is impacted by sunlight. We are designed and organized to come up with the sun and go down with the sun. And so as we enter into the fall and into the winter months, our days are shorter, depending on where we are on the planet. In southeastern Louisiana, we probably get about an hour and a half to 2 hours less of sunlight during this time, which impacts our circadian rhythm, which impacts mood, energy levels, and our ability to behave in ways that are more effective.
Well, and it kind of sounds similar to like we always hear the medical stories whenever there's daylight saving. It's kind of the same sort of thing, is that when you lose something, you lose that amount of daylight, there's going to be a change. And I know this time of year, people are taught to be tough, power through, and you may be thinking to yourself, if you're watching this right now, I'm feeling off. I'm just feeling a little off right now. I don't feel myself. I'm feeling a little down. Is this just in my head? And you would tell them it's not.
And I would say it's not in your head, and in parts it is in your head, because the brain is impacted by sunlight. And so one of the ways to mitigate that is to change the time you wake up. So I would recommend, and mental health professionals would recommend, that you actually adjust your wake up time so you wake up closer with the sun and go to bed closer with the sun when the sun goes down. So it might be a little challenging. If the sun is going down as early as 5 or 5:30, to say to go to bed at that time is a little challenging.
Especially when you got kids and things going on. And sometimes our schedules don't allow us, but you got to try.
We have to try. And so maybe going to bed closer to 9 or 10 as opposed to midnight.
Got it. Yeah. And when we talk about, people, especially in New Orleans, that work hospitality industry, you talk about first responders, people like us who just have very strange schedules, but working in other things, you want to get the light exposure, but there are some other things here that you can do to try to mitigate some of that fall sadness.
Yes, that light exposure is very important, especially in the morning hours, perhaps like about 9 or 10, to get that 20 to 30 minutes, and physical activity, to get out there and walk during the daytime so you can get that 20 minutes of sunlight exposure that can help regulate your mood and energy levels throughout the day.
Yeah, and we talk about so much about, the exercise that does such good for the body, but it really does so much for the mind. I can't stress enough. Somebody who's been trying to work out several times a week for years now. It definitely helps improve your mood. Anything else you want people to know that could, maintaining a routine probably helpful for you as well?
Yes, that routine with regard to getting up and going down with the sun, maintaining social relationships with people, so contact with one another, eating regularly, going for walks, exposure to sunlight in the early morning hours, all those things.
Well, and going on a walk with somebody can help. That's the other part, is just not being too much of a hermit, trying to get out and be around people. That helps.
Yes, go with your spouse, go with your kids, go with your dog. Just go ahead and engage with someone else that you can regulate your mood.
Yeah, absolutely. Well, Dr. Salgado, we always appreciate you coming on, and really good tips there, especially as we get into this fall weather. Let's get over to meteorologist Zach Verdella now, who's going to have a little bit more about this fall weather that we're not quite feeling yet.